Okay, hello everybody. Welcome to Oncology Watch. I'm Marty with Rocky Mountain Cancer Centers. Today we're excited to have Leslie, who is one of our social workers, talk to us about support resources for caregivers. Leslie received her BA with a focus on psychology from Skidmore College. She received her master's in social work from the University of Denver, integrating health and wellness within social work. Leslie's experience includes outpatient hospice in Children's Hospital of Colorado, and she recently received her oncology social work certificate. Leslie's goal is to provide excellent support to those navigating the difficulty of the cancer diagnosis. Please add any questions you have in the chat and we will review after the presentation. Okay, Leslie, we're excited to hear.
Wonderful. Well, thank you all so much for joining. And today we're just going to be going over a couple of challenges that caregivers often face, some tips and some resources about that as well. So first, caring for a loved one with cancer is incredibly prevalent. With over 1.5 million new cancer diagnoses each year and more than 12 million cancer survivors, it is estimated that 2 of every 3 American families will at some time have at least one family member diagnosed with cancer and one potential caregiver. I'm sure many people right now that are watching are either actively caring for someone, have previously cared for someone, have received care from a family member, or have been impacted by caregiving in some way. And it's just interesting to note a lot of times when someone is diagnosed with a cancer diagnosis, there's a lot of focus on the patient's needs, all of that. So this is just a little bit of an intentional moment to kind of, again, review what caregivers for cancer patients are experiencing, some of those challenges, and then some tips and resources as well. So again, there are many different types of challenges that caregivers who are caring for cancer patients face. One study found that cancer care impacts 4 dimensions of the caregiver's quality of life, including physical, psychological, social, and spiritual well-being. I would argue that there are a ton more. Just for examples, caregiving can impact family roles and dynamics, financial, logistical changes. So really going through what these types of challenges are that caregivers face will be really helpful just to first of all understand what these caregivers are experiencing, but also just to shed light and hopefully have those caregivers understand that they are not alone in experiencing this, because sometimes being a caregiver can be a little bit isolating. First, we'll look through physical challenges. Caregivers often experience physical symptoms of their own while caring for cancer patients, including insomnia, fatigue, and overall diminished health because of the strains of caregiving. In addition, when providing complex care for extended period of time, caregivers are at increased health risk due to the limited time to rest, engage in self-care activities, or to seek medical help when they need it. So that's a really key point. Caregivers really can experience large amounts of stress that can exacerbate many physical issues. Just for an example, if you're a caregiver providing support to your loved one who has cancer and they need assistance with a physical transfer from a bed to a chair, that can put a lot of strain on your physical needs. So it's really important to recognize some of those physical challenges and also pay attention to them to seek that medical help when you need it. Again, one thing you'll hear many times over is that you cannot care for someone else if you can't care for yourself. So essentially, take care of your own needs, and that way you can take care of others. Sometimes you hear that in terms of the oxygen mask on airplanes. You know, you're always told to put on your own oxygen mask first before putting on someone else's, just so that you can actually do that. In addition to physical challenges, there are a lot of psychological and emotional challenges. Family caregivers report feelings of anxiety, depression, fear, helplessness, anger, guilt, and uncertainty, yet often do not seek care for themselves, which again calls back to the fact that they don't often seek medical help for themselves either. Not surprisingly, caregivers typically put the needs of their loved ones before their own needs as well. but giving all of your mental and emotional energy to caring can be very draining. Oftentimes, caregivers report they're just too busy or too focused on the patient's needs to really take time and reach out when they're struggling. However, we do know that getting the emotional support that people need when they're struggling helps not only the caregiver, but also the patient as well. In addition to physical and psychological and emotional challenges, if you are providing care for a family member, that can cause a lot of family changes and dynamic changes as well. One study found that a cancer diagnosis often leads to increased family member interaction, changes in family roles, and an interdependent relationship between the patient and the family caregiver. Becoming a caregiver really can change that dynamics, especially if some of those dynamics already existed, or it's really changing how communication happens, all of that. So it really can cause a lot of stress on family roles and family needs. However, some positive news is that the same study found that families that exhibit open communication patterns reported less burden, less depression, and less abandonment. So again, even though there can be a lot of family changes and dynamics, taking intentional steps about addressing communication issues can help reduce some of those challenges. And the final challenge we're going to talk about in terms of caregiving is that financial and logistical challenge. One thing that often caregivers report is the financial and logistical challenges that arise are kind of just they're expected to deal with them. You're like, oh, they'll handle all of that. My caregiver, my wife, whatever that looks like, they'll figure it out. And as we know, these are really inherently complicated dynamics. So complex synth management presents a challenge to caregivers who are often unskilled and uneducated about the care that they need to provide. And they often have to take extra steps to gain that knowledge. Just for an example, if you've never provided care for someone before and all of a sudden you need to, and that person has complex medical needs, you might have to learn how to be a CNA. You might take extra time to read up on information. You might schedule a specific visit with a home health nurse about how to provide a specific type of care. And all of that takes a lot of time and mental energy. And caregivers do a lot. Just, with a normal family dynamic, there are lots of different roles and tasks that each person is associated with. When someone in the family has a diagnosis of cancer and that reduces the amount of tasks and roles that they can participate in, those tasks and roles fall typically on the caregiver and other family members. And so one study found that they had so many different tasks. These are just, some of them. But caregivers can assist patients with household tasks, cooking, shopping, running errands, coordinating appointments, providing transportation, moving furniture, helping patients to maneuver transfers such as moving from the bed to the chair, managing paperwork, filing insurance forms, and collecting prescription medications from the pharmacy. That is a lot to be taking on if they're already taking on other family roles. And some caregivers have to do all of these other tasks in addition to continuing with a typical job or employment. So a lot of these logistical challenges are very complicated for families to manage and to figure out how they are. And this often leads to, confusing family dynamics, things getting missed, definitely a lot of tension and confusion. So why we really addressed those challenges was to first, again, show that caregivers have to deal with a lot, on top of just emotionally watching their loved ones struggle with a cancer diagnosis. But when these challenges occur over time or very frequently, sometimes they can lead to caregiver burnout. Caregiver burnout is a state of emotional, mental, and physical exhaustion. If you're a caregiver experiencing burnout, you probably are going to have difficulty providing any level of care to your loved one, and that care might not be at the level you want it to be. So caregiver burnout looks a little bit different for every individual person, but we'll go through some examples of what that might be. You might feel anxiety, depression, irritability. You might feel helpless or hopeless. You might be feeling tired, run down, and having much less energy than you once had. You might notice you have difficulty sleeping, or you're constantly exhausted even after sleeping or taking a break. You're overreacting to minor nuisances. You're increasingly impatient and irritable with the person you're caring for. You might notice new or worsening health problems. You also could be coping in some unhealthy ways like drinking, smoking, or eating more. You might have trouble concentrating or remembering all of the intricate pieces of caregiving. You might have trouble relaxing even when help is available. You might notice you might feel increasingly resentful. It's hard when your life revolves around caregiving, but it doesn't give you very much satisfaction. You also could be neglecting your responsibilities, letting pieces of the caregiving just fall aside, or you're cutting back on the time that you need to take care of yourself. So if you are experiencing some of these kind of signs or symptoms of caregiver burnout, or you're, have been a caregiver for a few years and you've experienced all of these, or you're just starting out as a caregiver, just know that you are not alone in this, that your feelings are completely valid, that you can grieve, feel exhausted and burned out, while also 100% choosing to be there for your loved one and not loving them any less. And give yourself permission to feel what you are feeling. Caregiving is complicated and difficult, and trying to not allow yourself to feel what you are feeling will just make it more complicated and difficult. So what can you do? Caregiving, you can't just say, oh, I'm done, I don't want to do it anymore for the most part. What can you do to address those challenges that you're experiencing? What can you do to reduce the chance you're experiencing caregiver burnout, or to address the caregiver burnout that you already are experiencing? Well, for caregivers, everything is a little bit unique and individual. What we'll go through is a couple of different kind of sections and pieces of helpful tips that caregivers have shared in the past or experienced in the past that they've said, yeah, this moment was helpful for me. First is addressing communication with the patient and the healthcare team. Right now, especially during COVID, we are getting some feedback from caregivers that just say they're not feeling included in their visits. They're not feeling part of the conversations about treatment plans, next steps, things like that. And that's really hard when you are trying to provide the care for this person, but you're not included in part of those pieces. So if you are experiencing those feelings, request that you are involved in those office visits, medical oncology office visits, those things. Right now, again, they will have to be virtual, probably via video or over the phone. But again, that's a way to be included in some way and not miss some of those pieces if you're feeling that. Another aspect that we hear a lot from caregivers is feeling like they're not on the same page with the patient in terms of what they're thinking about, in terms of what they want for treatment, what their plans are, what their care needs might look like. And that can be really complicated. Again, the goal is really, as a caregiver and the patient, to be on the same page. You can kind of agree with what you need to have done. And so if, as a caregiver or a patient, you're feeling like you're not on the same page, you might want to consider family or couples therapy to help with that communication, learn some tools, techniques, resources about how to have kind of a better, healthier conversation, again, to make sure you're on that same page and get the best care you can get. Along with that, some caregivers and patients have a difficult time discussing the patient's values and wishes about their medical care, or the caregiver's values and wishes about the patient's medical care. And so that can be a really difficult conversation, again, especially if you're not on the same page. But even if you are, talking about those things is complicated. There are lots of emotions that come up. So if you're feeling like, we haven't really had that conversation, but we're interested in, we're not really sure how, our RMCC social workers do provide advanced care planning counseling visits where you can kind of sit down, discuss those values and wishes, look at corresponding medical documents, really in a neutral place so that you can kind of talk it out and, again, be back on that same page. And then finally, in regards to communication, try and set realistic goals. As we discussed, caregivers take on so many different tasks, often in addition to tasks they were already taking on prior to becoming a caregiver. And some of those tasks might not be realistic in being expected. So really having a good conversation about what are some realistic goals, what are some goals that you just feel like you can't meet, and how do you address those goals if you're as you as a caregiver are not able to do that. Trying to have that open communication about realistic goals and expectation can be really helpful when there's kind of a complicated or a crisis issue. Another thing that caregivers can do is carve out time for self-care. And as we looked through, when we were looking through that challenges, it's really hard for caregivers to take that time to do that. So again, self-care is really individualistic. It's going to be what feels right for you. But here are just some helpful tips that some caregivers have shared. One thing that you can do is schedule routines with time for yourself. When you're a caregiver, you're often scheduling routines for the patient based on when they're getting medication, when they need to eat, when their doctor's appointments are, all of those things. But try and be intentional and schedule a moment or two or just time for yourself to really be, again, intentional and acknowledge that time. It's just as important as making sure that patient takes the medication on time. Another thing you can do is spend a few minutes a day on something that gives you joy. It can be as little as writing in a journal, cooking something that you love, taking a walk outside. You can also connect with other caregivers via support groups or online communities to kind of hear what they do for self-care management, and also just to really connect emotionally. With self-care, just know that spending time on you is not selfish, but it really helps you become a better caregiver. And then finally, try and engage in activity that's just for you. It's similar to something that gives you joy, but sometimes something that gives you joy involves other people and, for example, cooking for other people. But try and find one thing that you can do that it really is just for you. Another thing that caregivers can do to really help themselves in this process to address burnout, address these challenges, is manage your own needs. Just like I've said a few times before, you can't take care of someone else if you're not taking care of yourself. And we often find that this is pretty common with caregivers, that they put off, medical appointments, they put off their own health because they're so focused on the patient. And again, this is just some examples of what managing your needs could be like, but again, it'll be kind of specific to you and what works for you in your life. One thing that people often always report is maintaining good sleep hygiene and a balanced diet. Also, address your own health concerns. Go to your doctor appointments. They are not less important than the patients you're caring for. And that's something that people have a hard time getting past. You can also manage your needs if you are employed, connect with your employer or HR department to discuss your work options. You might, as a caregiver, need to, take some time off. You might need to step back your hours, look at part-time, even discuss FMLA. These are things that you won't really know what your options are until you have that conversation with your employer. And then finally, manage the piece of your soul. Practice mindfulness, look at meditation, do something for your spirituality, whatever that might be for you, but really make sure that those needs are fulfilled as well. And finally, asking for help. Again, as we've discussed, caregivers have a really hard time with this. It's a lot easier to ask for help for someone else than it is for them. But it is a huge important piece because being a caregiver of someone with a cancer diagnosis is hard. Doing it all on your own is really difficult to make sure everything gets done and nothing gets missed. So here are just some ways that people have asked for help. I find that helpful. You could connect to a support group or counselor, individual counselor. This is really helpful to kind of just emotionally process, again, all those challenges, experiences, pieces that are going through your mind. If you're noticing you're having a lot of those challenges come up that we discussed, connect with your RMCC social worker or your oncology clinic social worker to help navigate those challenges. Things like financial support, transportation resources, emotional support options, food assistance, things like that. Your social worker can really help maybe take some of the pressure off. Try and ask your family or community for support and whatever that might look like. learn to be more comfortable accepting food drop-offs, medication pickups, transportation assistance from family, friends, or the community. And then finally, if you're feeling like everything is all too much, you've tried all these things, you can always discuss with your physician, with your RMCC social worker, oncology clinic social worker, respite options, and feel like if you really need some kind of physical break for a little bit, for you to kind of get back to the place you need to be to provide good care. So with all of those different types of tips, I put up a couple of different resources here. The first one I put up is the most important one. Connect with your RMCC social worker or your oncology clinic social worker. Again, some of the resources I've added here are great, but if you are looking for a greater variety and breadth of resources, that your social worker will be able to point you to them. Plus, they'll be specific to your own community. Because this is a virtual education piece, we have people probably from all over the state of Colorado. And so we'd want to make sure you're connecting with the right resources for you. If you are also interested in support groups, which people find very helpful, there's a variety of different ones in our community here. They are all virtual at the moment because of COVID. The Colorado Cancer Coalition, they have a support group list that they keep up to date, and you can go to this website there or just search Colorado Cancer Coalition support groups, and they have some great ones. There's also a great caregivers and loved ones support group run by Claire up in Boulder, again, also virtual. And then finally, RMCC is going to be starting a new caregiver support group in April, which I'll talk about in just a moment. If you feel like, support groups aren't really your thing, you're more interested in a one-on-one, there is a great program for peer support through the Cancer Hope Network for caregivers specifically, where it connects you to one-on-one a caregiver who might be experiencing something similar. So you're welcome to look at that information as well. Some people are more interested in websites and kind of reading information. So there are some great websites here about caregiving, what that looks like, and also a great book for facing cancer together in partnership. So again, these are some great resources to start off with, but if you're looking for anything more specific or a greater list, please contact your RMCC social worker or your oncology social worker. And then, as I said, RMCC is going to be starting a caregiver support group in April, kind of an open processing group for people for caring for those who care for others. So if you have any questions or you'd like to register, please call Amy, one of our social workers, at this number. If you're not able to get that information, it will be listed in our RMCC's online support group calendar. I believe it's already up there. But if you are having trouble finding it, just reach out to your clinic social worker and they'll be able to connect you to Amy. And then finally, I wanted to quickly discuss a caregiver opportunity that's happening right now. RMCC is collaborating with Memorial Sloan Kettering and the cancer support community on running a trial of a counseling intervention specifically aimed to help anxious or depressed adults over 70 and who are coping with cancer. And so the study is presently looking for a few patients and caregivers of patients 70 and older to participate in a once per year advisory council meeting virtually to help share insights for further development of the intervention, study, and recruitment. The advisory council members are paid $500 for their participation, and the first meeting is likely going to be held in April. So if anything about this sounds like a good fit for you, you'd like to know more, please contact one of our social workers, Jill, at this number, and she can provide more information about it. And if you, again, are able to get her number from this, just connect with your clinic social worker and they'll be able to connect you to Jill. So that's really all I had in discussing, again, some of those caregiver challenges. What are some helpful tips about addressing that caregiver piece and those resources for caregiver support? So now we'll kind of move to the question section.
Great. Well, thank you so much, Leslie. This was such great information. You were saying how caregivers have a hard time sometimes asking for help. And do you have any ideas on how they actually would approach like friends and family to ask for help?
Yeah, so it's really difficult. Every family and friends, you have kind of different ways you communicate with each other. A lot of times people can say that a lot of friends and family reach out to them and say, oh, I want to help with this, I want to help with this, and it can be really overwhelming. So as a caregiver, I would encourage people to, set up a time, kind of that intentional moment with people that they were maybe looking for additional support for, and say, here's what I'm looking for, here's what would be helpful for me, and here are some things that wouldn't be helpful for me. So creating some of those boundaries to kind of give them some additional support while not being too overwhelming can be very helpful. Outside of family and friends, I know some people have had a lot of success asking for support in their faith communities. And a lot of times those faith communities are very open to trying to find ways to support people through this.
Those are great ideas. Thank you. Another question that came to mind when you were talking was about financial support for caregivers. Are there any options for them financially?
Yeah, so there are a couple of different pieces. Most of the financial support for people experiencing cancer are really for the patients. However, if a patient does receive that financial assistance, it likely will help go to caregiver needs as well. So if you are kind of interested in general financial assistance for people going through that, you are welcome to contact your RMCC social worker to see what you might be a good fit for. Outside of kind of those general resources, more focused towards patients, there are a couple ways for caregivers to get some of that support. One is looking at if they are full-time really providing care for someone, is looking at getting paid for that caregiving. There are a couple of programs, one through PASCO, but essentially you take some classes, you learn to be a CNA essentially, and then get paid for that work. So that can be very helpful in reducing some of that concern of financial if you are spending a lot of time on that. And then outside of those two, I would say looking at other resources that might be helpful for people experiencing cancer would help take off some of that pressure as well. Just as an example, if you as a caregiver and you're the patient is your family member and you've been struggling to manage everything and every month food is a little tight, look at talk to your social worker about some of those food assistance resources, which not only will help support the patient, but could also maybe help support the whole family as a unit.
It's a great idea. Well, thank you so much for your time today, Leslie. You provided us with so much information. That was so great. So we really appreciate it. And for all of you out there, this presentation will be available on our Facebook page. And if you have any additional questions for Leslie, feel free to write them in there and we will respond to you quickly. Thanks so much and have a good day.
Thank you.